When assisting with ambulation using a gait belt, prepare the patient and then lower the rail on the side that you will work on. Have the bed in its lowest position and then raise the head of the bed, or you can help the patient adjust into a high Fowler's position. When assisting a patient in a chair, have her sit up and her feet flat on the floor. Then, help her sit on the side of the bed for a few moments, with her feet dangling on one side, and allow her to take a few deep breaths before proceeding. You can then apply the gait belt while she is resting, making sure that the best is under the breast on female patients. Assist her in putting on a non-skid slippers or socks and non-skid shoes. Check if she feels dizzy or lightheaded. If she says yes, take her blood pressure. If necessary, make additional arrangements. For example, if the patient is weak or unsteady, have another caregiver to follow him or her with a wheelchair. If the patient is attached with a continuous IV infusion, get a portable IV pole and another caregiver to assist with this. With patients with a urinary drainage bag, be sure that it is carried below the level of the bladder and that the tubing is free from any tension. When you are sure that the patient does not feel lightheaded, help her into a standing position. If she becomes unstable or dizzy, have her back sitting on the bed. If not, then let her stand until she regains her balance. Tell her to stand straight, hold her shoulders back, and look ahead, not on the floor. If the patient has a weaker side, then stand on that side. You should hold the gait belt in front of her waist, and your other hand should be under the belt at the back. Then take a few steps. If the patient becomes weak or dizzy, return her to the closest bed or chair. Ask for additional help if necessary. When you are in the hallway, be sure to place yourself between the patient and the wall and encourage her to use the handrail with her stronger hand and walk normally for the distance required. It is important that during ambulation, you walk in the same pattern as the patient, stepping in the left foot and the right foot at the same time that she does. Check her body alignment and balance when standing or walking. If the patient shows signs of falling, support her in a gentle slide to the floor and lower your body with your back straight and knees and hips bent, and then call for help immediately. When helping a patient ambulate using a cane, apply and use a gait belt as shown previously, then put the cane on the patient's stronger hand. Tell him to move the cane forward 6 to 8 inches and to the outside of his stronger leg, and then assist the patient to take a step forward using his weaker leg. The toe of his weaker foot should be even with the tip of the cane. Ask the patient to put his weight on the cane and weaker leg, and then step forward with his stronger leg so that his stronger foot is side by side his weaker foot. You should walk in the same pattern as the patient, using right foot and the left foot at the same time as the patient. When assisting a patient using a walker, apply and use a gait belt as previously shown, then help the patient to get into the frame of the walker. For a walker without wheels, tell the patient to move forward by lifting the walker and setting it down 6 to 8 inches forward. If the walker has wheels, then tell the patient to move forward through rolling the walker. Assist the patient taking a step forward into the walker with her weaker leg and then move her stronger leg forward. You should walk in the same pattern as the patient, using your left foot and right foot at the same time that she does. Ask her to keep her chin up and look forward while walking. Whichever device was used, ambulate the patient to a distance instructed by the charge nurse. As a follow-up care, after ambulation, return the patient to the bed or chair and remove the gait belt. Ensure that the patient is comfortable and can reach anything that she might need.